So a lot of things have been talked by the seniors regarding the lipids levels, control, risks. So we all know when our parents used to say from our childhood, beta ye khana hai, ye karna hai, ye nahi karna, ye karna hai. Since long, when I was young, my father used to say, beta play game. So I bought a Ludo. So then he said, no, you have to play, and you have to play those games in which you move. You do an exercise, you run, you play cricket, you play hockey, you do play football, you play wrestling. और एक गेम होती थी गलियों में, हम जो उसको वंजवटी हिंदी में कहते हैं, वो हम करते थे. तो हमें फोर्स किया और उसने लूडो मेरा फाड़ दिया बाबा. सो दिस इज द थिंग. बट अनफॉर्चुनेटली नाउ एक चीज आई है जो बड़ी खतरनाक है और बच्चों में वो एडिक्शन हो गई है. आई एम नॉट अगेंस्ट मोबाइल, बट द यूज ऑफ मोबाइल, दैट इज द वेरी डेंजरस थिंग विच इन आवर सोसाइटी. इवन बाप अगर बेटे से बात कर रहा है तो बेटा मोबाइल में बिजी है. सो दीज आर आल्सो दी non-pharmacological treatments of the dyslipidemia. So I will not skip a lot of my slides, but just talk on the dietary changes, exercise, nutritional supplements, and other lifestyle measures. So everybody knows that why do we talk of the anti-lipid therapy? Because it is the main cause, as told by our speakers, that it is not the risk factor, but it is the causative agent that leads to the atherosclerosis and all the consequences of ischemic heart disease, coronary heart disease. And not only the coronary arteries are involved, but all the arteries of the body are affected. So dyslipidemia, everybody knows what is it, and abnormalities of plasma lipoproteins in our body responsible for transporting major lipids. This is the thing which has been discussed. So it may lead to the problems in the coronary arteries, cerebrovascular, peripheral vascular disease, things. So direct relationship between LDL levels and new onset of coronary heart disease and recurrent coronary events, that is proved by the Framingham study, multiple risk factor intervention trial, lipid research clinics. So it is prevalence is also talked about this. I will switch to pathophysiology. Everybody knows that what it does, and look at the vessels that by progression that completely blocks the vessels. So if not controlled, then it may lead to the MI, ischemic cardiomyopathy, sudden death, stroke, erectile dysfunction, peripheral vascular disease, and acute limb ischemia. So we need to explain to the patients and all those who are coming to us that this is an important thing. They must get tested for lipid profile and the thyroid. So this is again risk factor score by which we can assess the how much risk of mortality and morbidity is there. So there are a lot of factors considering age, cholesterol levels, and smoking patterns and other things. So treatment approach, this has been talked that what is the risk, low risk, intermediate, high risk, or very high risk. When their patient is of very high risk, then we need to be aggressive and more aggressive therapy with the high doses of statin and other things is to be given. So dietary changes. डॉक्टर कुरैशी साहब ने बताया कि एक चेंज कोई भी इंडिविजुअल ट्रीटमेंट है, कोई भी कंसिस्टेंट थेरापी नहीं है, बट एक कंसिस्टेंट थेरापी है जो हर पेशेंट को है, दैट इज द लाइफ स्टाइल मॉडिफिकेशन एंड द डाइटरी चेंजेस एंड द एक्सरसाइज. So adopt healthy diets such as Mediterranean dish or portfolio diet rich in fruits, vegetables, whole grains, nuts, and healthy fats. So we have to explain in their language that what to eat, what not to eat. So this is very much important. हम कह देते हैं भाई saturated fats ना खाओ, polyunsaturated fats लो, लेकिन we have to be brief and clear that what to eat, what not to eat. Exercise, हम कहते हैं भाई दौड़ो, कौन सी एक्सरसाइज करे, किस वक्त तक करे, कैसे करें? सो कंबाइन एरोबिक एक्सरसाइजेस दैट इज ब्रिस्क वॉकिंग, और जो कहते हैं कि 1 मिनट में 100 to 120 स्टेप्स होने चाहिए, with resistance training regularly to lower LDL and triglycerides and raise HDL. And this is the only way that HDL is raised by exercise. Weight management, achieve and maintain ideal body weight to reduce triglycerides and improve overall lipid levels. Nutritional supplements have been proved to affect the cholesterol levels, omega-3 fatty acids, niacin, red yeast rice, and all these things. Some supplements are like garlic and coenzyme. अच्छा, मजे की बात है, ये कहते हैं कि वो गार्लिक आप खा लें या जो हम सिंधी कहते हैं वो खा लें, तो लेकिन no randomized trial has proved that there are effects with this. So other lifestyle measures, smoking cessation improves HDL and reduces oxidized LDL. Together, these interventions can reduce LDL cholesterol and triglycerides by 30 to 40%, improving cardiovascular risk without drugs in many patients. Pharmacological therapy is reserved for high risk or unresponsive cases, but should complement lifestyle changes. So, how to raise good cholesterol? Lifestyle changes known to increase HDL cholesterol have been shown to lower the risk of heart attack. These changes include moving more, quitting smoking, and eating diet rich in vegetables, fruits, and whole grains. But medicines used just to increase HDL cholesterol levels have not lowered the rate of heart attack. Interestingly, in my practice, I have seen a lot of patients that they say, sir, वो हम कोलेस्ट्रॉल वाली दवाई तो नहीं खाएंगे, हमें प्रॉब्लम. जब आप किसी को बता देंगे भाई ये स्टेटिन्स आपको बॉडी में दर्द करेगा, इसके साइड इफेक्ट्स हैं, तो नेचुरली हमारी रिलेशन ऐसी है कि वो कहेगी हमें तो हो रहा है. तो दैट इज व्हाई वी मस्ट बी प्रॉपर इन आवर काउंसलिंग, एक्सप्लेन इन प्रॉपर वेज दैट भाई ये वो तो 100 में से 2-4 लोगों को होता है, हर एक को नहीं होता. अगर हम कहेंगे ना ये मायोपैथी होती है, इससे साइड इफेक्ट्स है, तो वो कहता है मुझे तो हो रही है, पहले ही मुझे दर्द रहता है, जिससे मैं कैसे खाऊं. Which food will reduce the cholesterol? And some contain plant sterols and stensols which block the body from absorbing cholesterol. Oats, barley, and other whole grains, beans, eggplant, nuts, vegetable oils, apples, grapes, strawberries, citrus fruits, foods fortified with sterols and stensols. So, which food is bad for cholesterol? What are the worst foods for high cholesterol? Red meat. हमेशा हम कहते हैं कि white meat is better than red meat. But मैं कहता हूँ कि vegetables are better than any meat. So, try to have green vegetables and other fruits in your diet. So, how to control cholesterol with diet chart? Healthy foods to lower cholesterol. These are the things: beans and lentils, fish, and olive oil. So, the foundation of the treatment of dyslipidemia is optimal nutrition diet and ideal body weight combined with aerobic and resistance exercise program in all patients. So, Pakistan Lipid Forum, I advise that they should also give a program of exercise, and they should set a form how to do, what to do, and when to do. So, depending on degree of cardiovascular risk, nutritional supplements or the drug therapy is the next step. For the low to moderate risk patient, nutritional supplements are the second cornerstone of therapy. In the high risk and very high risk patients, pharmacology agents are needed and should be used in conjunction with diet, nutrition, and exercise, weight loss, and scientifically proven nutritional supplements. So, recent guidelines with National Cholesterol Education Program recommend more aggressive control of serum lipids to reduce the incidence of coronary heart disease. Nutritional and dietary therapy, weight loss, exercise, and scientifically proven nutritional supplements should be used initially in appropriately selected patients to manage dyslipidemia. Hypertriglyceridemia frequently due to obesity, insulin resistance, metabolic syndrome, and diabetes mellitus deserves special attention. Thank you very much.